Do you know that headache you're having is not normal, but your body is trying to tell you something is wrong? And do you also know that not all headache are the same, and treating them wrongly can make them worse? In today's video, I'll break down the common types of headache, what causes them, and how to stop the pain fast. Ensure you watch till the end, as it will really worth your time. Hi everyone, welcome back to my channel Ask Your Nurse. If you're seeing my video for the first time, thanks for stopping by. I'm Ashamulu Ashion. I'm a registered nurse. This channel focuses on content related to health. Do well to like, subscribe to my channel, and turn on your notification bell below to be the first person to know the next time I upload another new video. And to my returning subscribers, thank you guys for all you do. Headache are broadly divided into two major groups, the primary headache and the secondary headache. The primary headache is the headache that is not caused by another disease. Headache itself is the main problem. And the first type of primary headache is the migraine headache. Migraine headache is a serious type of headache with throbbing or pulsating pain, usually on one side of the head, with nausea, vomiting, and you may find light uncomfortably bright, even though others may not find it so. And this is called photophobia. Also, loud or constant noise can overstimulate the brain and worsen the headache. Migraine headache can be caused or triggered by hormonal changes, poor sleep, certain food, and stress. When estrogen level falls, it may cause serotonin level in the brain to drop suddenly, and the sudden drop of serotonin can make the brain more sensitive to pain. And that is why migraine headache usually happens before or during period, menopause, and pregnancy. Also, hormonal changes can make the blood vessels in the brain to narrow or widen suddenly, leading to throbbing pain. Migraine headache often runs in families, which means you have higher chances of developing migraine if your parents have it. But note that it is also influenced by lifestyles, stress, poor sleep, and diet. So if your parents have it but you manage your stress, you sleep adequately, and avoid food that can trigger it, then you may not experience the symptoms. Food that can trigger migraine headache are coffee, red wine, chocolate, nuts, processed food, and artificial sweetener. Migraine headache can also be triggered by skipping meals, dehydration, and strong odors. Now, how can you relieve migraine headache? One is to stay in quiet and dark room, apply a cold compress on your head, sleep adequately, avoid and manage stress. You can also take simple painkillers like paracetamol, ibuprofen, or aspirin if the migraine is mild. Cafegot may be prescribed by your physician, which is mainly for migraine headache. Also, antiemetic may be prescribed if there is vomiting or nausea. But if your migraine is severe and frequent, then you may need to visit your healthcare professional for proper evaluation and higher medication. Another one is tension headache. This headache feels like a tight band around your head. The pain is usually dull and aching, and this is mostly caused by stress, poor posture, dehydration, poor sleep, and eye strain from prolonged phone scrolling or too much screen time on your laptop. Tension headache is common among students and people that use phones or laptop a lot. How can you relieve tension headache fast? One is to drink a lot of water, stretch your neck and sit upright, ensure rest, massage your temples, and reduce your screen time. You can also adopt the 20-20 rule, where you will look 20 meters away and hold for 20 seconds, then you repeat every 20-20 minutes. This helps to reduce strain on the eyes. Cluster headache is another type. It's very painful, it feels sharp and burning, and usually around one eye. This pain comes suddenly and can wake you up at night. This pain occurs in cluster and you may have red eye and tearing. Cluster headache is one of the most painful type of headache. What causes cluster headache are alcohol, smoking, or irregular sleep pattern. Cluster headache can be relieved by sitting upright, do deep breathing, and seek medical help fast if severe to get an expert management and treatment. The other group of headache is the secondary headache, and this headache is caused by an underlying condition. Examples are 1. Sinus headache. In this type of headache, you feel pain around your face, forehead, and nose. Sinus headache may be associated with fever and nasal congestion, where your nose will be blocked. The major cause of sinus headache is sinus infection, could be from bacteria, and allergies that causes allergic sinusitis. Now, how can you relieve sinus headache fast? You can relieve sinus headache by doing steam inhalation, warm compress on your face, taking plenty of fluids, and pain reliever medications like paracetamol, ibuprofen, or aspirin can be taken to relieve pain. Nasal decongestant like nasal spray for blocked sinuses, antihistamine if it is related to allergies, and antibiotics if bacterial infection is confirmed by your physician. Hypertension headache is another type of secondary headache. This occurs when your blood pressure is high, and it's usually felt at the back of the head, especially after waking up in the morning. And this headache is not usually relieved by painkillers, but only goes when your blood pressure is brought down. So to relieve hypertension headache, you need to see your healthcare professional immediately to check your blood pressure and commence you on antihypertensive medication. Ensure you rest and sleep adequately and regularly monitor your blood pressure. Another type of secondary headache is rebound headache or medication adaptation headache. This is usually caused by medication overuse. When you take painkillers all the time, the brain becomes dependent on the medication and adjusts to frequent drug use, making the natural pain control in the body to become weaker, which will increase your pain sensitivity. Even mild trigger like hunger or thirst can make you have headache, because when the effect of the medication drops, the headache starts again, creating a cycle of pain, medication, and rebounding pain, which makes treatment difficult. So what can you do to prevent this? Do not overuse painkillers, not even paracetamol. Treat cause and not your pain. See a doctor if your headache is frequent. Another cause of secondary headache is dehydration. When you are dehydrated, oxygen and nutrient supply to the brain is reduced. Also, because your brain is 75% of water, dehydration shrinks the brain tissue and pull it away from the skull, causing pain. Take a lot of water to relieve dehydration headache. Hunger can also cause headache. Hunger headache is usually dull and steady, and it's usually felt at the forehead. It may come with dizziness, irritability, and weakness. Hunger causes headache because when you did not eat, your blood glucose drop, reducing glucose supply to your brain, and this triggers headache. To relieve hunger headache, eat something light immediately, like food that contains a lot of glucose, whole grains, protein snacks. To avoid too much caffeine, as caffeine can also trigger headache. Other serious types of secondary headache can be from brain tumor, meningitis, or head injury. These types of headache need immediate medical intervention. You need to also see your healthcare professional if your headache is sudden and severe, if it occurs with fever or stiffness of the neck, if it causes blurred vision or confusion, or if it occurs after head injury. Headache may be common, but not all headache are the same, and it should not be ignored, as one of them may be dangerous. If your headache keeps coming back or feels severe, get checked by a physician. Do not just treat the pain, but treat the cause. Thanks for watching till the end, and don't forget to like, share, and subscribe to my channel for more educative content like this. See you in my next video.